Hello, everybody. Welcome to another McKnight's one-on-one interview with a leader who is helping shape the senior living sector with some more exciting new ideas and developments. This is Jim Berkland of McKnight's, and I'm thrilled to say I'm with Julia Rizhevsky, Vice President of Product Management for Senior Care and AI Strategy with PointClickCare. So first of all, thanks for spending some time with us, Julia.
Thank you, Jim. It's great to be here. I look forward to the conversation.
Absolutely. So let's jump right in. Julia, can you give us a high-level view of what you're seeing across senior living as we go deeper into 2026, especially as operators segue more intentionally toward resident wellness?
Yes, of course. Senior living is absolutely going through a real shift right now. Our customers are telling us that they're looking for ways to support resident wellness more proactively as part of their mission. And they're doing it while juggling lots of other things as usual. They're managing lean staffing models and they're managing rising expectations from residents and families. And what we're hearing from communities more specifically is that they want real-time visibility into how residents are actually doing day to day. They want their teams to be able to be aware of small changes early so that they can respond and coordinate more effectively. And we are seeing this sentiment play out in our data as well. We recently published our senior living industry trend survey for 2026. And we see through that operators are very clearly looking for tools that help support resident wellness and that early insight. So, for example, 94% of our respondents said that they're exploring AI tools for this purpose. And I think what's telling is where they want to apply it. So they're
Hmm.
most interested in tools and capabilities that directly support the resident experience. So in my mind, the direction is clear. The industry is really moving towards a more proactive, wellness-centered approach, and the technology is playing a bigger role in helping deliver on that.
Yeah, and isn't that really gratifying to see that 94% are into it and they kind of know what they want? I think we're past a little bit of that shaking out period where, yeah, this is a tool, something we're going to need. Just spot on, I would say. So I'd like to turn to this growing focus on wellness in senior living and care. You mentioned a growing shift that it's become. So what does that actually mean in practice, though?
So I would say that senior living has always been about quality of life. That's not new. What is changing now is how communities are staying connected to that mission. So in practice, it means that the teams are paying closer attention to each resident's day-to-day patterns. They notice when something shifts. Maybe someone is eating less, or maybe they're less social than usual. And when you catch those things early, it really changes everything downstream. A wellness team can have that conversation with the resident and their family before a situation escalates. A service plan can get updated faster. Ultimately, the goal is to keep residents safe and thriving for as long as possible, avoiding falls, avoiding unnecessary hospital visits. And our study backs this up too. So 71% of respondents said that risk monitoring and predictive insights are where the tech could most meaningfully improve the resident experience. And that's because, like I said, operators want to act earlier. They don't just want to respond when something goes wrong.
Outstanding point. I mean, and folks, this is why we have these interviews with people like Julia, just killing it. And I really want to know, though, why do you think this shift is happening now?
So I think a few things are converging now. First is that baby boomers are entering these communities with very different expectations. They want to maintain their highest possible level of independence for as long as possible. They want purpose, they want personalized services. And second is that the data and the capabilities are finally here. So communities have been collecting information for many years. It's in their EHRs, it's in their assessments and incident reports, but it's scattered across different tools, different formats. Sometimes it's even on paper. And so now there are tools that can actually make sense of this data. They can pull it together, make it useful in real time. So For the first time, operators can act on the data that they already have instead of going out and gathering more data. And the last thing is that operators are recognizing that technology can improve the resident experience itself, not just be part of admin workflows. And I think that's a meaningful shift in their mindset. For a long time, the technology conversation in senior living was about billing, compliance, documentation, those kinds of things. And I think what's shifted is that operators are now asking, what can the technology do for the person living in the community? How does it help the resident? How does it help the caregiver standing in front of the resident? And that's a really different starting point.
I really like that. I've heard in every answer you've had, incidentally, I've noticed it's the person focused thing, whether, of course, it's the patient slash resident or the worker with that. And I mean, sometimes we forget about these things, but let's peel back the layers now a little bit of this emerging AI landscape in senior living. You mentioned before that 94% of survey respondents talked about exploring AI. So, what are operators actually thinking about in this regard?
So there is so much noise around AI right now, right? Everybody's talking about it. It's not always clear how it works in these settings that we're talking about. So we went straight to operators and we asked them, not are you interested in AI, but we asked them where do you want to apply it? What problems do you want it to solve for you? So three things come up to the top. It's predicting health risks, it's personalizing care and service plans, and it's enhancing communication with families. Each of those come in at about a third of respondents. And that tells you where the industry's head is right now. It's not about operational efficiency so much, although, of course, there's ways for AI to play a role there. But operators are really focused on how AI can support their wellness teams and keep residents healthier. I really feel that they're cutting through the hype on their own. They're asking, how does it help the resident in a real way? How does it help the caregiver who's with that resident every day? How does it help the family member who's worried about their mom?
And that is a great point because we find ourselves repeating over and over and reminding folks AI is not just hype or a logo or something to advertise, it's a tool. So, what I'm hearing from you is people are looking, how do we use this best and how best to improve patient resident care? So, now I want to get to an important connector to all of this. What framework should senior living leaders use when evaluating AI technology?
I would say that there are probably three things to keep in mind. The first is it has to fit into how people already work. That's probably the one that I feel most strongly about. If an AI tool requires a separate login or a separate screen or a separate workflow, it's really not going to get used. Caregivers are busy, they're moving between residents, they're documenting, they're communicating with families, and the technology has to meet them where they already are inside the systems that they're already in. Otherwise, you've bought something, but nobody is using it. The second thing is, does it solve a problem that your team actually has? It's always best to start with a problem and not start with the technology. It's easy to get excited about what AI can do, but I think the better question is, what is actually costing the team time, or where are things falling through the cracks? If AI doesn't connect to one of those things, it really doesn't matter how impressive or fancy it is. And the third thing is to start small and prove it out. I know that one sounds really simple, but I've watched organizations try to roll out AI across every workflow all at once, and it usually stalls. So the teams that get traction typically pick one thing, one high value workflow. Maybe it's fall risk, maybe it's service plan updates, and they run it for 60 days, 90 days. They measure what changed. Did staff actually use it? Did response times improve? Did anything shift clinically? And then they take those results to leadership and say, here's what happened, here's what we learned, and here's where we go next. So it's really that you show people what worked and then you do more of it.
Absolutely. I mean, there are a lot of metaphors, cliches, whatever, about taking a bite at a time and getting through it, walking before you run. But I think kind of proving proof of concept, I don't know if that's the exact phrase for it, Excellent idea on that. Now, how do you see AI and emerging technologies shaping the future of care delivery, and what role is PointClickCare playing in that transformation?
So we have already been doing this in skilled nursing for quite some time. AI is live, it's in production, it's being used every day, and now we're building senior living specific capabilities as part of our 2026 roadmap. So you should expect to see a number of different announcements throughout the course of this year. And one of the biggest things we're working on is documentation. If you spend any time in the community, you see how much of a caregiver's day goes into writing things down. We're looking at ways that AI can really take that burden off their plate. So they still have a complete full picture of every resident, but they're not spending their shift typing instead of caring. We're also testing AI that can look across a resident's entire record and flag when something is not right. So it's the kind of thing that maybe no single data point or event is alarming on its own, but a pattern is. It's something that a busy team might not connect those dots easily, but the AI can surface it and say, "Hey, let's take a closer look here." And for us, the thing that we come back to every time is that AI has to support a caregiver's judgment, not replace it. And it has to explain why it's flagging something. It has to suggest a next step, not just generate an alert. And again, it has to be right there in the system that people already use, not some separate thing that they have to go find. I think what gives us an advantage is that we've been in post-acute for a long time. Our AI is built on clinical data, it's been validated through peer-reviewed research, and it sits inside the EHR. So that means that when a caregiver sees a recommendation, it's based on something real. They can act on it without leaving the screen that they're already on. And now, as we bring these capabilities into senior living, the goal is pretty straightforward. It's less documentation, it's earlier awareness of risk, it's better conversations with families, and ideally staff that feel like the technology is actually helping them do their job instead of just adding to the pile.
Just outstanding observations and way to take it apart. And that really does get to the heart of what it's all about, doesn't it? And we've come to expect nothing less from Point Click Care. I'm Jim Berkland, and this has been another special McKnight's one-on-one interview. Once again, I'd like to thank PointClickCare's Julia Rizhevsky for laying out what a wellness-first transformation should look like in senior living. And I'd like to thank you for tuning in. We'll see you again next time. Until then, as always, we wish you good health and outstanding days ahead.